All right, so just get the recording
Sure,
started.
sure.
So this is Nicholas Webb, and I'm here with Robert Newman. It's March 28th, 2018, and we're here in the archives office at Annenberg. So
Nice to be here.
Yeah, glad to have you here.
Thanks.
So where to begin? I know you said you had something there from the board.
Sure. Maybe I should just start, if you want. I mean, I can start anyway. But,
Yeah.
Ray Trussell's coming to Beth Israel.
Yeah. So
And then his recruitment of me to Beth Israel.
Yeah,
because
that would
they're both interesting
Yeah,
stories.
that's a great place to start.
In 1965, I think it was end of 64, beginning of 65, Ray Trussell was completing I think it was a 3-year term as head of the New York City hospital system with 23 different hospitals.
Yeah.
He had temporarily given up his position as dean of the Columbia School of Public Health, did the hospital job for the city, then left the city in order to return to becoming dean again at Columbia School of Public Health. Just one interesting story about him that's always stuck in my mind. The day after he left the city Department of Hospitals, he went back, and in those days they still had elevator operators, and he went up the elevator just to clean out his office, and the elevator operator, according to Ray Trussell, as he got in the elevator operator said, "You know, Doc, around here there ain't nothing as dead as last year's commissioner." And I always remember that. And when I left Beth Israel, when I left Continuum, I never interfered with anything because I said, "Geez, there's nothing as dead as last year's commissioner." Anyway, he went back to become dean, and he was very seriously involved with the chairman of psychiatry at Harlem Hospital, who was also a full professor at Columbia School of Medicine, Professor Elizabeth Davis. Absolutely wonderful person. She was as white as you and I, but she was completely African American.
Yeah.
And her father and grandfather were both bishops of the biggest church in Harlem. And Ray and Beth were basically an item. And one day, soon after he returned to the deanship, Ray is riding up the elevator at Columbia, and one of the most senior deans of deans was in there, some fellow from, I think, North Carolina, and he was talking to a person on the elevator, and Ray overheard him say, "You know, it's a sad day in hell when a dean of Columbia messes around with black girls." And Ray Trussell, I mean, he repeated it to me many times, got off the elevator, went to his office, hand wrote a note saying, "I'm sorry, I'm giving up my position here, effective immediately." Charles Silver, who was president of Beth Israel at the time, heard about this, called Ray Trussell, and I don't think he ever even met him, said, "I want you to come and talk to me about becoming head of Beth Israel."
Yeah.
And so Ray Trussell, without any introduction or anything else, goes down, and sure enough, he's appointed the first non-Jewish head of Beth Israel, and stayed there 10 years. And Ray, 7 years into his tenure there, invited me to lunch, and we had minimal contact, usually adversarial contact, in terms of methadone treatment. I wanted private doctors, and he didn't, and so on. And he invited me to lunch, and he said he was going to retire in 3 years at age 65, and there was nobody at Beth Israel who was even a candidate to take his place, and would I come and be associate general director? And I remember I said, "But Ray, I've never we were on last name terms. I said, "But Dr. Trussell, I've never had any experience whatsoever in a hospital. I've never worked in a hospital other than as a surgical intern and resident." And I remember Dr. Trussell said, "You know, I've been worrying about this and thinking about this." He said, "I just can't think of anybody to ask." He said, "Dr. Newman, do you know anybody?" And of course I said, No, I don't know anybody at all." And his answer was, "You see?" And with that totally unflattering introduction, I started first part-time and then full-time. And I was there as the Associate General Director for 2 years. And the board asked me to become a General Director, which was CEO at the time. And I was taken to lunch to discuss a contract by Harold Fearman of Fearman Hall. And at lunch, Mr. Fearman, said, "Okay, now let's talk about the contract." immediately agreed on salary and that sort of thing. And they said, and what about the term? And my response was, listen, it can be anything. It doesn't have to have a term at all. You just say, at will, either part. And remember, he put down his fork and he said, why would we want to have it on term? He said, we want you to be, the CEO. And I said, yeah, but, maybe it'll turn out, I've only been here 2 years, the number 2 position, maybe you won't like me. And he interrupted me, he said, why wouldn't we? He said, is there something about you that we don't know, Dr. Newman? I said, no, Mr. Freeman, I think you're going to be very, very happy. He said, okay, we want a 15-year contract.
Yep.
And sure enough, I should have said probably, your board is so screwed up. I'm not going to go to work for, you're going to get a 15-year, no way out contract to somebody, essentially granted. And they gave me this 15-year contract. And there was absolutely, so anyway, and it worked out well, and I stayed there almost a quarter century. But it's unique. Number one, it's very flattering to me, and it shows the conviction of the board.
Yeah.
It's irresponsible. Really completely crazy.
Yeah.
Anyway, so that was my introduction to Beth Israel. And they were pretty unusual from then on.
Yeah.
And I brought you a whole bunch of, you probably have a lot of these.
Some of them we have, some of them we might not.
But anyway, whatever you want, you can have, and again, if you keep anything, that's fine. Just make me a copy of it.
Yeah.
I can't remember. Did you have in your timeline the contract with 1199?
Yeah, the no layoffs contract.
The no layoffs contract, which, and I hadn't remembered until I went through these old papers. We had the no layoff contract, I think it was in February. And starting in May or June, the League of Voluntary Hospitals negotiated. And I remember they were very unhappy with Beth Israel. And what I didn't remember was that it made the newspapers, and the hospitals were very, very unhappy about it. Anyway, so I'm leaving this with you, and they were really very unhappy. But again, it was typical of the relationship between medical board, medical staff, administration, and trustees. Something as radical, unheard of.
Yeah.
And I remember it was a phone call. I had a meeting with the 3 top people in the administration, head of personnel, head of finance, head of operations, and I quickly convinced them that this was a good idea to pursue.
Yeah.
I got on the phone with Mort Hyman, and Mr. Hyman immediately said, fine, sounds terrific, go ahead and pursue it.
Yeah.
And again, it's just unheard of, that type of relationship.
Yeah. And I know, because even 30 years later, talking to people who've been, who are on just, employees in 1199, but that loyalty that generated is still very much there. That people, they really felt like as employees they were part of a community in a way.
And I think the ones who are still there still feel very good about those old days. When I go down there, it's usually engineering and housekeeping. Those people, and they come up and they embrace me, and I have no idea who they are. I say, "Oh, you look terrific. You lost weight." What can I tell you? But again, it's the relationship between the trustees and administration. And I've just never encountered anything like that in any other institution, hospital or anything else. And there was basically, my job was to deal with the chairman of the Board of Trustees. I had contact with all of them, went to lunch and everything else, but I never had any political discussions or any trying to convince people of anything other than Mort Hyman. And usually I would be able to convince them, sometimes I wouldn't. That would be the end of it.
Yeah.
And when I convinced him, then he would take care of convincing everybody else.
Yeah.
The no layoff clause, I discussed it with Mort Hyman, and Mort Hyman broke the news. These big-time Jewish men, businessmen, and it was just never an issue.
Yeah.
So it was pretty unique.
Yeah, I know you talked about that in the Federation interview, that it was, and before Mort Hyman, obviously, it was Charlie Silver.
Yeah.
And he seems like kind of a larger-than-life character.
He was. Charlie Silver used to make daily rounds with Mrs. Howard, Rose
Yeah.
Muscatine Howard was the head of nursing. And he would make the rounds to all the private units. And he would go in and say, how are things, and so on.
Yeah.
And he'd make small talk, and he would just do it all the time. And it just showed his, and he would say hello to people on the way,
Yeah.
but it just showed his devotion to the hospital. Would come in every day, and he was just devoted. He
Yeah.
also had some great tales. I think it was Mr. Petrie, who at one time was, for many years, was the head of Toys R Us, which is now going belly up. But I think Petrie was very close to Charlie Silver, because Charlie Silver somehow bailed him out when there was some kind of a clothing problem, and Petrie was big in the clothing field.
Yeah.
So Petrie was very indebted to him. And they went out to lunch one day, and I heard this directly from Charlie Silver, and Mr. Petrie gave him a check for, I think it was $500,000, and Charlie Silver just never got a check for $500,000.
Yeah.
And he started to cry, Charlie Silver did.
Yeah.
And he goes back to the office and he finds a note from Petrie saying, $500,000 is not worth crying about. I'm sending another $500,000 to make it $1 million. Again, it just shows
Yeah.
the relationship among the senior members
Yeah.
of the board as well.
Yeah, and then obviously Petrie in the 80s became, I have my timeline here open, that he was the biggest donor. I mean, what was it, 10 million was in the largest pledge ever made?
I think that was Phillips.
Hmm.
Was it Petrie?
Yeah, I have it.
Yeah, it
this
could
is-
well be.
it's
Yeah,
from the
because
annual-
Phillips also gave 10 million.
Yeah.
I mean, actually, the Phillips family gave a lot more than that.
Yeah.
But there was I think the $10 million gift was for the naming of Phillips Ambulatory Care Center. I think that was Phillips. I might have mentioned it in the oral history, but just as a reflection of the Phillips family and the magnanimous, really, to me, unique generosity of that family.
Yeah.
Larry Phillips, who is the son of Seymour Phillips and the grandson of one of the 25 founders of Beth Israel, he gave, as I recall, it was about $500,000. No, not $500,000. I think he gave $5 million. He gave multi-million-dollar gift in order to allow us to recruit it was 109 members of NYU, including Fred Epstein, who was one of the leading pediatric neurosurgeons anywhere, and also Max Berenstein, who was this brilliant endo-neuro-radiological interventionist. And we brought them up to Beth Israel North, former Doctors Hospital, and we just assumed that we would call it the Larry Phillips Neurological Neuro Center. And Larry said the Phillips family has its name on enough things. I mean, the library, the ambulatory health center, the nursing school. He said this should be called the Hyman Newman Institute.
Yeah.
I mean, who ever heard of that? A multi-million-dollar gift to this, probably at the time, the most prominent clinical service at Beth Israel. And Larry Phillips said, no, make it the Hyman Newman Institute, which is good. We had a celebration marking that at the top of the sixes.
Yeah.
And I remember when I had to say a few words, I said, listen, Hyman Newman Institute is so long. I said, my suggestion is we just sort of compromise. We ought to take the first 3 letters of Mr. Hyman's name and the last 3 letters of my name and just call it the Newman Institute. Actually, it was the other way around. And he got a laugh, fortunately. But anyway, but it's, again, I just mention these things because they're, in my estimate, they're kind of unique in the hospital world.
Yeah.
And it reflects on the environment that existed at Beth Israel.
Yeah.
So what can I tell you?
Yeah. So let's go back to the beginning. So when you were first recruited by Dr. Trussell in 75, so that was just as the governor affiliation was kind of coming to an end.
The governor affiliation had just come to an end, and Reynaldo Ferrer, had been, I think, the head of governor, or he was the head of the liaison, and he was appointed by Ray Trussell to be his one of the 3-4 top people in the administration. And when I took over as CEO, Almost immediately thereafter, Ray Ferrer was recruited to be Commissioner of Health by the New York City Health Department, and served in that capacity with not such an easy term, but served in that capacity. And but that was the end of the governor relationship, and we still had a relationship with Judson Family Health Center, which was part of the Judson Church arrangement. But especially under Trussell, it's always been a very community-oriented place.
Yeah.
He was, by the way, Ray Trussell was distraught when that affiliation ended. He was there, so.
Yeah, I've just recently been kind of looking into the history around that, because I know it's a big community issues with...
There was something called Lena and Nina. There was a Northeast Neighborhood Association and a Lower East Side Neighborhood Association, and my actually initial and only contact with them was when I was creating the city's methadone maintenance program. And this was, an ultra radical group, young people who wanted nothing to do with methadone. I remember, and my wife, who's Japanese, who at the time had only been in the country for a couple of years, spoke very little English, and I happened to bring my wife along for some reason, and we were discussing methadone, and one of the people there said, we don't want any methadone because methadone makes you like a zombie, and you're zonked out all the time. And I remember pointing to my wife and saying, listen, if I told you that my wife, before I married her, was a heroin addict on the streets of Tokyo, and that she has been on methadone for the last 8 years. Now you look at her, talk to her, you tell me if she looks like what your vision is. And they look at her and say, no, we would never suspect anything. And I remember I walked out at the end of the meeting, my wife said, what did you say? And what did you say? I should roll up my sleeves or something to show the and I said, hey, don't worry about it, don't worry. I think it was years before I finally told her. But they finally said, okay, you go ahead and do it. So that was my only contact with that. And it was either, I think it was Nina or Lena, one of them.
Yeah. So obviously I have my timeline here. So stepping forward a little to the early 80s. So that was when, BI encountered AIDS for the first time, and doctors encountered AIDS for the first time. And I know Donna Milvan was really involved with that.
And I always knew that Donna Milvan played a key role nationally and internationally in identifying HIV. But I was struck a few years ago at the New York Historical Society. They had an exhibit dedicated to AIDS. And I would say and I remember sending Donna a note at the time, about a third of that exhibit focused on Donna Milvan and Beth Israel. I mean, it was really extraordinary. And we have no connection with the New York Historical Society, but it was recognized that she was one of the key people.
And I've talked to a couple of people who've really said that was, pushing. Because, obviously back then people didn't know yet how it was transmitted. They didn't know the details. And so just the fact that you were taking these patients in and willing to treat them was already, that was a...
Well, we did a couple of things. Number one, we had an outpatient service for them. Number two, we created an inpatient unit dedicated to HIV/AIDS. And I'll never forget, there was a Puerto Rican man with AIDS who was clearly near death. And he had been living with a Puerto Rican, partner for many years. They had a kid who was 8 or 9 years old at the time. And one day they came down to see me, and they said, listen, we'd like to arrange to be married on the unit before, my future husband dies. And I said, absolutely no problem. And I said, we'll, arrange for a priest to come in. And I remember the woman saying, priest? No, we don't want a priest. The Jewish rabbi is going to marry. And I said, the Jewish rabbi? I said, but you're not Jewish. I said, no, we're Catholic. But the Jewish rabbi, the chaplain, has been so wonderful to us and so supportive. He's the one we want to, and it just reflects the attitude of that. And then of course we created the Maplethorpe, I don't know what we called it at the time. Residence for people who could not have independent living, but really didn't want to go into some big nursing home and might have had a problem getting into a nursing home. And that was a lot of problem because the building directly across the street was the Dvorak they called it the Dvorak House,
Yeah.
and had a plaque, and what it really was it was a brownstone, and 100 years earlier, on the top floor, Dvorak had a room.
Yeah.
And in that room, he apparently composed the New World Symphony, and that was the Dvorak House.
Yeah.
And we said, we'll put up a plaque that's 3 times as big, and whoever heard of the Dvorak?
Yeah.
But the community really went completely nuts about
Yeah.
that. And we prevailed with the Landmarks Commission, and it turned out all right.
Yeah.
but very soon after the merger with Sinai was closed, and I guess the feeling was it just wasn't necessary anymore.
Yeah. Well, it's just, do you happen to recall the name of that rabbi who was?
Yes. Oh, Jesus. God. I'll think of it. I'll think. Oh, I know exactly the person in Navajo. I don't know if you know the name Navajo. Okay,
Nope.
She was a patient representative, and I'll get the name. He was chaplain for 20 years, 30 years.
Yeah.
And I remember we used to have an annual Beth Israel gala dinner, and the rabbi would make some kind of a benediction or something. And I'll never forget, I was sitting with one of the trustees, and after the rabbi finished, he said, "That was the longest speech we're going to hear tonight." It was the rabbi. I just can't remember that, but I'll think of it, and I'll send it to you.
Yeah. Yeah. So one thing I'm curious about, actually, is I know that there had been the Bernstein Institute had been at the Lying In Hospital, and then in the early 80s, that building was sold, and you bought the New York Infirmary that was next door.
That's
And was that just because it was a more modern building that had come on the market?
No, no. Well, first of all, it lent itself to being attached to the main building.
Obviously.
The head of that, of the New York Infirmary was Mrs. Kresge, and she decided to give up the New York Infirmary because they created Beekman Downtown Hospital.
Yeah.
And so the logical, group to whom she approached to consider buying it was Beth Israel. And so, I can't remember what the terms were, but that had been a New York Infirmary.
Yeah.
And so Beth Israel took it over, and then when it had it, connected, we no longer needed the Bernstein Pavilion, so we sold that.
Yeah.
There was something, and I don't want to create problems among descendants, but the son who died in this accident, and I'll never forget, it was, there's a gas station when you turn right on, I think it's 23rd Street or 19th Street.
Yeah.
There's a gas station right at the river. But there was something about that accident which was unsavory.
Yeah.
You didn't come across that.
I mean, I know.
Trying to think of what the hell it was.
Yeah, so the version I've heard is that he was a resident, and it was on an emergency call on something, whether it was an ambulance accident or.
That's a hell of a lot more
on.
favorable an account than I heard. So we'll forget about mine.
Yeah, so I don't know the details.
Yeah,
if there's other versions of the story, I don't know.
But there is a story about the Bernstein Institute. Charlie Silver, and I think he probably just told it to me. He arranged to purchase Manhattan, New York, New York Infirmary. Not New York Infirmary, the Bernstein Institute.
Manhattan General.
Yeah, and that's right. And he said he called, I think it would have been Ray Trussell, and he said, "Dr. Trussell, what did you tell me to do about Manhattan General?" And according to Trussell said, "Well, I really urge you to look into buying it." He said, "Oh, thank goodness, because I just bought it." I couldn't remember what I was supposed to do, but I just bought it. And it just shows the way things were done, really informal, lovely basis.
Yeah, I know because you told that story in the Federation interview that it was, Trussell had, back when he was commissioner of hospitals, had written a letter to the board saying, this would be, they're doing great stuff here, it should be part of a, voluntary.
I think I got a copy of that letter.
Hospital, and they did it. He said, he said, what was he? It was like, New York needs more services like this.
Yeah. And I mean, Vince Dole, with whom, I had at the time, I don't know, 4 or 5-year-old son, and once I said to him, the best friends you have in the whole world are coming to dinner, and his immediate response, "Oh, Vince and Marie?" I mean, that's how close they were.
Yeah.
And Vince told me that at Trussell's urging, Dole arranged to meet with the board at Beth Israel. and this big imposing boardroom, and he went in there and all these, elderly Jewish prominent businessmen, and he said he was just sure they would say thank you very much and send him out the door, and he finished his presentation about methadone maintenance, which at the time, was, the first paper had come out 6 months earlier.
Yeah.
And it was Seymour Phillips who got up and at the end of the presentation, without discussing anything with anybody, Seymour Phillips said, Dr. Dole, I'm sure I speak to the entire board when I say, just tell us what you need and you can have anything you need.
Yeah.
And, so, again, and this was at a time when even alcoholism was considered to be a problem that didn't affect Jews.
Yeah.
And drug addiction, Jesus, in 1965, another group of people, but, they came in, and Beth Israel had one of the first comprehensive alcoholism programs, and of course the addiction program, the maintenance, and the detox program with 150 detox beds.
Yeah.
So.
Yeah, because I know someone I'm really interested in hearing more about, because I've been trying to find out more about him, and there's not much there, is Harold Trigg. Because I know he had been at Manhattan General before, if I'm understanding correctly, before it was bought, and was in charge of the inpatient service there.
God, I wish I could remember more about his background. I remember he was a very impressive guy. I mean, he had this office on the second floor. He had this great big photograph of himself in this long coat, and he just classical picture of a pimp. You look at that and say, oh, that's a very good-looking pimp. I mean, and he had it there, and he knew exactly what it. But when he was interviewing people, talking to people, he would sit there, and generally he would be knitting. I mean, he's this prominent psychiatrist, leader in the field of addiction treatment, key member of this academic, and he'd be sitting there knitting. And again, 1965, 66, 67, who ever heard of that?
Yeah.
But Trigg was terrific, and it was really a sad ending for Trigg because he decided to retire. And, I've always been a big fan of retirement. And within, I think it was 2 or 3 weeks of his announced retirement, he was diagnosed having metastatic cancer. And I remember we said, listen, we're going to rip up your retirement papers, so you're going to have all the insurance and all the other coverage forever. And he did, but he died pretty quickly there.
Yeah.
And I don't know about the pre-Beth Israel days, what he did, but I know that he was the key clinician. But we also had an internist, Mort Davidson.
Yeah, I did an interview with him.
Oh, you did? Okay.
Yeah.
Well, he was the medical director of the detox unit.
Yeah.
And I can't remember how he related to Harold Trigg. I know there was never any friction among any of those people, but I always thought that Harold Trigg was the head of the detox unit. But maybe Harold Trigg was the maintenance side, because he worked very closely with Marie and Vince, who had nothing to do with the detox.
Yeah.
So I think that was Mort Davidson.
Yeah.
How is Mort? I haven't seen him.
He's doing well. He's living down in Florida.
Is he in Florida?
Mm-hmm.
Yeah.
Yeah.
He and Alice Davidson?
Yeah.
They used to have a home up in right the northwest corner of Connecticut, where I have a home.
Yeah.
And so we were 5 minutes apart up there.
Yeah.
No, he was a lovely guy.
Yeah, he was doing well. We had a good chat with him.
And he was, I think, the son-in-law of Sam Hausman,
mm-hmm.
right?
Yeah, he was. Yeah.
Gee, that goes back a ways, too.
Yeah.
I'm always amazed what I remember. Not nearly as amazed by what I forget. But
yeah. I was down in Disney a couple weeks ago, and I saw the boardroom and the big picture of Sam Hausman.
That's right.
Yeah.
It's also a great picture of Cy Phillips and a great picture of Mort Hyman over there also.
Yeah. So moving on, in the one thing I'm really interested in is the acquisition of what became Beth Israel North and the Singer Division, Doctors Hospital. So I know in the 80s and 90s there were two proprietary hospitals that you guys bought. There's Doctors, and then there's Kings Highway.
Kings Highway we bought.
Yeah.
And it was a physician. He must have been in his 80s. I think he created Kings Highway.
Yeah.
And Kings Highway, And he was the one who approached Beth Israel to buy it, and we did. I can't remember his name, but that was a purchase.
Yeah.
Beth Israel North was completely different. Beth Israel North was a I'm almost certain. I think it was a non-profit hospital. It was created right at the beginning of the Depression, 1929. And I think they had to stop construction for a while because they just had no money. Mort Hyman was born at Behind North, the old doctor. And I remember when we first, had a tour of the place, they had these archives, much, much more primitive than your archives. And I remember there was a guy, with typical, clerical outfit with a little hat with a visor and sleeves with leather. And Mort Hyman said, "Listen, could you check and see if you have any birth records on a fellow named Hyman, baby boy Hyman?" And Christ, within 3 minutes he comes up with it. And of course, nothing was digitalized. He comes up with it. So that was very impressive. No, Doctors Hospital, for whatever reason, decided that they should get out of the business and they should become part of a large academic medical center. They had no house officers, and it was, you'll have to check, I don't think it was a proprietary.
Yeah, actually I'm realizing, now I'm remembering, so we actually have some archival records from them. We have their board minutes going back to the Depression. But apparently it was actually, you're right, they were a voluntary hospital, and it was controversial in the 30s because they were all private beds.
Of course.
They didn't take any kind of,
that's right.
And so.
It wasn't
proprietary. It was voluntary, and it was actually a.
Do you remember the name of the CEO when we did Donald something?
Not offhand.
No, Don Hoskins was the medical director.
I couldn't tell you offhand. I know we'd have it on the paper somewhere, but okay. So anyway, they decided they should explore becoming part of a big academic medical center. And as I recall, they approached Montefiore, Columbia Presbyterian, and Beth Israel. And it sounds like a strange, trio. I mean, why not Mount Sinai, which is, right around the corner, or New York Hospital? But anyway, it was those three. And either Montefiore or Columbia responded by saying, "We're very interested, but we have to have due diligence, and we can't make any commitments, even tentative. We need at least 6 months to have, whatever, auditors, everything else." One of them said that. The other one said, "We got to think about it, whatever." And Doctors Hospital at the time said, as an expression of good faith, and that there's really a desire to maintain this hospital facility, we would like a commitment of whoever we signed it over to, a commitment of $12 million to be invested into, modernizing and expand whatever the facility. And they said that to all three, people that they approached, hospitals that they approached. And I'll never forget, they invited Beth Israel to a meeting of, it was about a half dozen of the Doctors Hospital board members and the CEO at the time. And it was some fancy office building down the Wall Street area. And Mort Hyman went, and I went, and Tom Hayes, who was the chief financial officer at the time, went. And they made a presentation about the hospital. We made a little presentation about Beth Israel. And then what Hyman said, and look, just to show you that we really have total confidence in Doctors Hospital, we have a total commitment. Tentatively, I've asked Tom Hayes, our financial, to bring along a check made out to Doctors Hospital in the amount of $12 million. And you take it, and if you decide, you want a different partner, just return the check. But meanwhile, this is a check. And I remember talking to Mort Hyman before that, and I said, "No, Mort, this is a no-brainer. Okay, if they go with another partner, they'll return the check. And if they go with us, on day one, if you wanted to, you won't. But if you want to say, hey, listen, we're going to take the $12 million back, and we're going to use it to build a center." But, so of course, and we invested big time, thanks to the Phillips family in part. Because very soon thereafter, we recruited this NYU team. It was 109 NYU staff members. It was physicians, nurses, anesthesiologists, social workers, 109. Yes, just brought the whole team over.
The whole team, it was pretty extraordinary.
Yeah.
And then when they and we had just purchased purchase isn't the right word. We had just acquired Doctors Hospital when we made this deal with the NYU folks. And I remember, because Doctors Hospital was a totally non-academic place.
Yeah.
It didn't have the greatest reputation because people thought, is it proprietary, is it voluntary, all
Yeah.
private business. And I remember meeting with Fred Epstein and Alex Berenstein, and I told them, listen, go have a look at the Doctors Hospital facility. Then go have a look at Roosevelt Hospital. This was 97.
Right.
We had just had them. And no question, you can pick whichever one you want.
Yeah.
And we just assumed they would pick Roosevelt. The long tradition, pretty new building, not a 60, 70-year-old
Yeah.
building. And they said, no, we like Dr.
Yeah.
So they all moved up. And they brought residents and fellows and everything else.
Yeah.
So it worked out well.
Yeah. I know that eventually did end up moving to Roosevelt after.
They
Doctors
did, yes,
closed.
when they closed,
Yeah.
yeah. And that was after my time. And I guess there was just, the attractiveness of the offer to buy the place was just, extraordinary.
Yeah.
I think it was $185 million or something like that.
Yeah.
It was some unbelievable amount.
Yeah.
At least for me, it was unbelievable.
Yeah. How about Kings Highway? So what was the story?
Kings
story
Highway,
there?
we were approached by this old Jewish doctor who owned the place.
Yeah.
And he said he, wanted to, he was thinking of selling it. And we said, a lot of Jewish people in that area, and Beth Israel had a large Jewish following from Brooklyn.
Yeah.
We said, this makes a lot of sense. And then there was this whole Russian Jewish community in Coney Island and in the South Brooklyn area. And so it made a lot of sense, and we bought it, and we did great things with the emergency room. We tried to acquire community hospital. But because, so as I recall, it was 12 blocks or something away.
Yeah.
But they were not interested, and they ended up hiring, not Shen, a wonderful Chinese-American fellow who had been head of Beekman Downtown Hospital. And so I had known him in those days. And I think he's still part of the Mount Sinai Empire, isn't he?
Yeah, I'm not, possibly, yeah.
I think it's
That's a
community.
name.
Although no.
Yes,
I'm sorry. He was at Community Hospital, Beekman, New York Infirmary, then to Community, and then Sinai appointed him as head of the Kings Highway Division. And I think he might still be head of the Kings Highway Division.
Yeah, I have to look into that. But I think I think you're right.
Yeah. I have one thing that is not in your timeline, and I've been trying to document it with Google, and I'm usually pretty good at that, and I just haven't been able to, but I'm almost certain that in I think it was the early 20s or 1915, 20, something like that, there was, another huge number of Eastern European Jewish immigrants.
Yeah.
And a significant proportion were denied entry to America because they were found to have trachoma, an eye disease.
Yeah. There's actually, I think
And Beth Israel, I've been told, going back 40 years, that Beth Israel was instrumental in finding and applying the treatment for trachoma. Have you come across that?
I've heard that story, but I haven't found any of the primary sources.
Yeah, well, I have a very, very good friend who spent the last 50 years at New York Eye and Ear in ophthalmology, and a classmate of mine from medical school. I'm going to ask him if he can.
Yeah.
Somebody who's familiar with that type of eye disease.
Yes, that's something if there's
just couldn't find
actual
it.
documentation, I'd love to know more about it. Like I said, like you said, I've heard that story too, but we don't know.
And there's another thing that I have to go through my personal files, but years ago I was in Warsaw, and there's a Jewish museum in Warsaw, and I remember walking through, and they had on display several photographs of maybe the original nursing class of Beth Israel.
Yeah.
And I can't remember why it was hanging there or what the but anyway, one of these days I'm going to find it. I'll send it along.
Yeah. That's great, man. I think that's something that's really, that they maintained that commitment to the Jewish community, to the to the Orthodox community, the really religiously observant community, right up. I mean, the cafeteria was kosher. I saw what you said in the interview when Rabbi Schneerson was there.
That's
that,
right.
Put mezuzahs on all the doors.
They put the door. Rabbi Schneerson, it was a demanding patient, but they were very, very happy, and they were enormously grateful. It worked out.
Yeah.
It worked out well. But the Jewish commitment, I don't want to create trouble with our new, partners, but the story I had heard, and it may be in the initial few years of the board minutes, was that Beth Israel Hospital was originally conceived and implemented by, the story was 40 Jewish businessmen who each gave a quarter each. I mean, that might be apocryphal, but I don't know. But that the reason for it was that at the time, and there's some reference to it in your video, no immigrant to New York would be accepted by any hospital in New York City until they'd been here for 1 year. And one of the hospitals that refused to accept them was what had been called the Jews Hospital, and then was called Mount Sinai Hospital. And it was this refusal to accept the new immigrants that led these leaders of the lay community in Lower East Side to say, we've got to have a hospital to take care of these people. And they did. So it was an interesting bit of historical perspective. Nobody's going to criticize anyone for what the policies were 150 years ago.
I've definitely heard versions of that story, and I've been meaning to look into.
I think you had indicated something in the 20s.
In the 20s, it was. So the board was visited. So obviously at this point it's long before Medicaid, but the city would pay for charity patients, and there was a rule saying that if you are an immigrant who has become a charity patient in a hospital, you will be deported because you're a strain on the city budget. And so a social service worker came to the board at Beth Israel and said, we want to find out what your policy is in these cases. And she was told that any immigrant patient, they will pay for them and not report them to the city, to avoid their being deported.
But again, I mean, that's a board let's say in the 20s, and then in the 60s, AIDS, and in the 60s, addiction treatment and alcohol. And I remember when Vietnam, that whole Southeast Asia area fell apart, we had Cambodian immigrants, and we had an interpreter, Cambodian English interpreter. I mean, she said, what's Beth Israel doing with it? And we did more circumcisions, I think, than all the other hospitals, because all the Russian and Polish immigrants, and this was in the 60s. So, but this responsiveness to needs, even if they were not related to Judaism. I mean, taking care of Eastern European Jews is one thing, taking care of Cambodian, and we hired, as I recall, the first sign language interpreter, full-time sign language interpreter at Beth Israel. And and it was over the decades, so it was really pretty extraordinary.
I think there's something I wanted to ask about that. Actually, going back to something I've seen references to in just little clippings we have, but don't know much about it. So at some point in the 70s and 80s, there was a program at Beth Israel for Soviet Jewish emigre doctors to get them acclimated to the U.S. healthcare system so that they could practice.
It may be, but my personal knowledge has to do with the German Jewish immigrants from Nazi Germany.
Exactly.
And there is, and the reason I'm particularly attuned to that is there was a physician, a surgeon named Helmut Nathan. And Nathan was in Berlin, and he happened to have been a friend of my folks. And he and his wife became clients of my parents who were into restitution law. But Nathan, in addition to being a surgeon, and he was initially at Beth Israel, the first place that took him. And then he went, and the rest of his professional career was at Einstein. And in addition to being a surgeon, he was also a sculptor and an artist, and really very. And he sculpted a bust of Einstein, bronze, and there were 4 of them that he made. One of them is at Princeton, where Einstein was. Another one is at Albert Einstein, College of Medicine. One of them is in the home of the Nathan family, and one of them is hanging in my computer room. And this fellow got his start at Beth Israel. I don't know what we did with. I mean, it's certain the Russian immigrants, maybe the Hungarian immigrants, 56. It certainly would be in tune with Beth Israel's general orientation.
The Einstein connection I know about is that I.W. Held, who was medical director for many years, he and his brother.
Held lecture. I know more about that from reading your stuff, watching it, than I do from anything else.
That he and his brother, who was the editor of the Jewish Daily Forward, worked closely with Einstein for emigre relief in the 30s for German
yeah,
Jews.
Yeah. But and I don't think Einstein had any direct involvement with Beth Israel. But,
no, I mean, the impression I get as I tried to research this is that every doctor who was associated with Einstein at any point in his career for the rest of his life said, "Oh, I'm Albert Einstein's doctor."
Yeah, whether he was or wasn't. Yeah. I once read about him in the newspaper. He has funny hair.
Yeah. But,
yeah, I had a couple of comments on your timeline, but I'll have to. What I'll do is I'll just type up some notes when I go home. And I do have in the 30s helped Jewish emigre doctors, for instance, Albert Nathan. I'll make some notes, in case you shed any additional light. And some of this is, some of these are just interesting old publications from Beth Israel. And then we were big initially in advocating for HMOs. We thought that HMOs were really going to be the wonderful one.
So that was New York healthcare in the mid-80s.
That was New York healthcare. That's right. And this is you came across the Japanese.
Yes, yeah. Actually, we have one to show you. This is something we have. That's the invitation that was sent out.
My God, 1990. Jesus. I don't think I had this. Could you make a copy of this?
Yeah, happy to.
Yeah, I mean, this was, again, it was, I just briefly give you the story that it may have been in my oral history, but my wife's Japanese. Everybody knew my wife was Japanese. It started off when I was still associate general director, and somebody came up from the emergency room, a doctor, and said, God, I got this patient driving me crazy. She's a Jap. And I remember saying, listen, I said, you don't know me, you don't know my family, but Jap is not a word that I like to hear in my office. Yes. The guy says, what's wrong with Jap? Japanese American princess. I said, oh, not Jap, Jewish American princess. I said, oh, that's okay. Not Japanese. Yeah. Anyway, so one night in the middle of the night, 2, 3 in the morning, I get a call, waking up, from the emergency room at Beth Israel. We have a Japanese woman here. We think she's crazy. We think she has to be admitted, but nobody can talk to her because she's Japanese. So I said, oh, good. I gave the phone to my wife, and I went back to sleep again. And the next morning, my wife said, you really should have a Japanese practice. There are so many Japanese in New York. Yeah. You ought to have a Japanese medical practice. And very quickly, I went to Chamber of Commerce. First, I went to the UN Japanese delegation here. They sent me to the Chamber of Commerce. There was some Japanese branch of it. Yeah. And they sent me to Tokyo Marine. And they said, if any group might be interested in this, it'd be Tokyo Marine. And 3 months later, they gave us a $1 million gift to create the Japanese medical practice. And at the same time, we created this Japanese residency program, which still exists. Yeah. I understand that 4 applicants to the program have just been admitted by Sinai Beth Israel for the year beginning this July. So I'm really very, very pleased and appreciative that that's continuing. Yeah. And I don't know if you know, but I, 2-3 years ago, was given an award with the impressive title, something of the, it was from the Emperor of Japan. And it was this unbelievable, the last American that I know got it was Clint Eastwood, who was honored for making a film about Iwo Jima from the Japanese perspective. Yeah. But this award, and I got this wonderful picture of it, was for me in my role of bringing a Japanese medical practice and the Japanese residency program to Beth Israel. Yeah. So, and I gather it's still going strong, and hopefully it'll continue to go strong. Yeah. I'm especially glad that it's Order of the Rising Sun with gold, with neck emblem and gold something or other. It's a hell of a title. Yeah. So it's really it's impressive, and that was because of what we did at Beth Israel. Yeah.
Yeah. Let's make sure I don't miss anything. Yeah. So I guess kind of the concluding the story here. So I know the Continuum merger obviously happened in '97.
Yeah.
And
that wasn't so easy because at first we approached St. Luke's Roosevelt, and they were very interested, and they said we have to consider it. And then they came back a few weeks or a month or so later, and they said, no, that we don't feel that there's a cultural affinity between St. Luke's Roosevelt and Beth Israel Medical Center. So they decided to pursue becoming part of Columbia Presbyterian. And it was a year later that they contacted us and said, listen, we decided Beth Israel would be a much better partner. We created Continuum.
Yeah. And so I know, and then you became CEO of Continuum for a couple of years before you retired.
Yeah.
So I know obviously just as are today, back then, a lot of changes going on and just administratively the practice of medicine. So what had been the motivator ultimately behind SLR's decision to reach out to you, rather than...
I don't know who reached out to whom, but we had contact earlier because, and again, it's extraordinary on the part of St. Luke's Roosevelt and on the part of Beth Israel. We had a radiology chairman who, the department was not a particularly good department, and he left, and then the problem was, whom can we recruit to run the department? And I had a medical school classmate who's still alive and well, named Ron Abloh, and I had approached him. He had been at Yale, wonderful, brilliant guy, had been at Yale, and I said, when I first got to Beth Israel, late 70s, I said, why don't you come and become chairman of Beth Israel? And he said, I've already started negotiating with St. Luke's Roosevelt, and I don't feel it's right. I said, yeah, but you haven't signed anything. What's the big deal? He said, no, it's a matter of principle. Okay, so he took the job at St. Luke's Roosevelt, and 5, 6, 7 years later, I approached him again. And I said, listen, I know you've got this shortcoming of loyalty, but I'm willing to overlook that. But why don't we talk to your administrators, and I'll talk to my board, and why don't you become chairman of both? St. Luke's Roosevelt Radiology and Beth Israel Radiology. Zero connection between the two. They had their affiliation with Beth Israel, with Columbia. We had an affiliation at the time, I think it was with Einstein already. And somehow I managed to convince him and his wife, which wasn't so easy. And then I went to see Gary Gambuti, who is the CEO at St. Luke's Roosevelt. And I remember his response was, well, will you take over $300,000 of his salary? I said, absolutely, no problem. So Gambuti was perfectly happy with that. And then I met with the fellow who at the time was chairman of the medical board at Beth Israel. Very nice internist who was a pretty religious Jew, not Orthodox. And I remember saying, listen, I got a somewhat unusual suggestion here. This wonderful guy, and I've known him since medical school, and he's great, and he runs a great department there, and we really need all the help we can get. And I assumed that this guy was going to say, you're going to have somebody share the reason. And he said, let me ask you one question. Is he a Jewish fellow? I said, but of course he's a Jew. It's okay. And that was the end of that. And we recruited him. It was unbelievable. And it worked out very. He ran a magnificent department.
Was he the guy who set up the filmless radiology?
Yes, and he's the one who, first at a meeting that I arranged for him and Mort Hyman and me talked about, and got Mort Hyman and me so excited about it. They had some preliminary program in Vienna, University of Vienna, and we kept, every few weeks, Mort Hyman and I would call this guy and say, so when the hell are you going to get started with it? He said, well, we're not ready, wait. But the funny thing with Ron Abloh was, I had a meeting in his office. He finally agreed, everything was set. He said, I want to introduce you to the guy that I want to bring over as my number 2 person. He brought this fellow into the room. And he was, he was a nice guy, but there wasn't anything, really striking about him. I remember when he left, I said to Ron Abloh, who was the chairman, I said, you really think that he's going to be the right guy? And I never forget this guy saying, you want me to take on an impossible job, a job that everybody's going to think I'm a total nut to accept to be chairman. And the most important decision I make is who's going to be my number 2. And you question, I said, Ron, anybody you want to bring over is fine. And of course, he turned out to be a super terrific chairman. That's Ron. That's Abiri, Mike Abiri.
Yeah.
And he was absolutely terrific. And he created this network clinic,
Yeah.
a network of radiology units.
Yeah.
So and when we joined with St. Luke's Roosevelt, I really, really desperately tried to be geographically neutral. I mean, I'd spent 25 years at Beth Israel, so it was tough. But I gave up the CEO position at Beth Israel, and we appointed, I think it was Peter Kelly or Matt Fink, somebody at the time. And I tried my damnedest to be neutral, but 20 some odd years of my life at Beth Israel, can't just forget about that.
Yeah.
And it worked out. It worked out okay.
Yeah. Let's see. I have my notes here and make sure. So this is going all the way back to the very beginning when you first started. But it's something I'm curious about. So I actually just found out about it this week as I was doing governor research. Did you know Howard Brown at all?
Yes.
He had been head of the ambulatory service
at
Governor at Beth Israel on,
No, I know the name. I don't remember.
Yeah, and then he went on.
He wasn't an HIP, was he?
He might have been, actually, because he went on to be Commissioner of Health. He was recruited by Mayor Lindsay from BI to be Commissioner of Health.
Well, that must have been early on, because when I got there, Mary McLaughlin was Commissioner, and a fellow named Gordon Chase was the overall health staff, everything, hospitals, health, mental health, everything.
Yeah.
And Mary McLaughlin was followed, I think, by Pat Imperato, who then went to downstate, and he was followed by Lowell Bellin, who was a wonderful, wonderful guy, public health fellow, had been dean at Columbia Presbyterian. Howard Brown must have come before Mary McLaughlin.
Yeah, it would have been in the late '60s, maybe.
That's right. Because I got to the health department in 1970, and it was already Mary McLaughlin.
Yeah. Yes, he is. Again, I just found.
And he came from Beth Israel.
He came from Beth Israel, and he had, but he was one of the first American physicians post Stonewall to come out of the closet.
Is that right?
In 72, 73.
Yeah. I think I know that.
Yeah. And he had been recruited
as he was before he was recruited.
After he was recruited. This would have been in the 70s after he left as commissioner. Yeah. But he was recruited as commissioner on the strength of his work running governor's outpatient program for BI.
Yeah, sounds familiar, but I don't think I ever remember. We did have I think the first ambulatory gay and lesbian health program, which I think ended up being entirely a lesbian health center, and it was sort of part of the OBGYN and primary care operation.
Yeah, actually, I didn't know that. That's when would that have gotten started?
It was when we first got Phillips Ambulatory Care Center going. It was, Jesus, I just can't remember. It must have been 1996, 97, something like that.
Yeah. Do you know offhand any names of who the administrators or the doctors were? That?
It was a woman who left us and went down to Florida. I got some young colleagues who were much better, and it was a woman, GYN, who, and she opened this center for us at Phillips.
Yeah.
I don't know if I covered it in my oral history, but again, just as a tribute to Beth Israel, in the early '80s, AIDS was already a major issue.
Yeah.
But it had nothing to do with my setting up a meeting at the Beth Israel boardroom. It was about 1984. In the Beth Israel boardroom, and we invited the gay and lesbian leadership from New York and maybe even beyond that.
Yeah.
There was Ginny Apuzzo. I don't know why I remember the name. She was with the state, I think, state health department. She was one of the leaders of the lesbian movement, and a number of others. And we had the board, about 20 people there. And I welcomed them, and I said, listen, the reason we're here, AIDS, of course, is a concern. We just want to know, what can Beth Israel do to support the gay and lesbian community, whatever problems you have. AIDS, of course, but whatever problems you have. And it was during that meeting in the boardroom, my office is right next to the board,
Yeah.
when a former employee walks into my secretary's office, and she may say, "Barry, how are you? It's been so long." He'd left out 6 months earlier. And he said, "Oh, I'm fine, and I just wanted to briefly see Dr. Newman." And my wonderful secretary says, "Well, he's chairing this meeting in the boardroom, but I'm sure he'd like to see you. I'll call him out." And this guy said, "No," he said, "I got some business over on 14th Street in the finance personnel department. I'll go over there first." He goes over there, and he has a duffel bag with him. He pulls out this machine gun, and boom, 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 and he ends up hitting 2 of the people. Didn't kill him.
Yeah.
Hit one of them in the arm, and I mean, the head of personnel, Jim Starr, the number 2 person in finance, Naj Perez, and he ended up having a list of people that he wanted to kill that day.
Yeah.
And at the top of the list was my name, and I was the only one in the administrative offices.
Yeah.
So I would have been an easy target. I was the only one. There, he had about 6 different names in finance, because he had worked in finance. And I've always said that, if there's a God in heaven, she was watching out for me, because as a reward for having set up this gay and lesbian health thing, otherwise I would have been dead. I mean, there's just no question about it. He would have killed me. So, anyway. So it's a proud history. Serendipity for sure.
Yeah.
Yeah. He ended up being a victim in the 9/11.
Oh. Yeah.
Did you know about this?
No,
guy?
I didn't know about that.
Jesus. He ended up being declared insane. They sent him to some psychiatric hospital. Then they released him to the hospital on the island, whatever it is, Manhattan State. And I was on the Board of Visitors, actually, at the time. And he was there for a couple of years, and then they released him to Brooklyn. And one day I get a visit from the FBI, and they said, "Listen, we want to talk to you about this guy, Barry Simowitz. What can you tell us about him?" So I told him the story. And I said, "Why are you asking about it?" He said, "Well, he works for the Post Office Department, and he has an office in the World Trade Center. And he's sitting in this big open office with about 12 desks. By chance, 11 of the 12 people are African American, and he's the only white. Name is Simowitz. And apparently, he almost every day starts singing at the time. Thank God I'm a white man in America." And several of the people reported him and said, "This guy's going to get killed."
Yeah.
And they didn't know anything about his history of trying to kill other people. And so the FBI put some kind of injunction. But he ended up dying in the World Trade Center.
Yeah.
So.
Was that the 93 bombing or the 9/11?
It was not in the 9/11.
9/11.
Yeah. Stan Brezhnev was head of the Port Authority. I think head of the Port Authority at the earlier in the 90s. That bombing he was in, and then he became head of Continuum.
Yeah.
And they became head of the Health and Hospitals Corps.
Yeah.
So interesting story. Listen, I'm going to send you the some of the comments or some of the questions I had. They're all trivial, and it was a good learning experience, and I'm delighted to mention.
Yeah, pleasure meeting with you. Like I said, glad I could get you to sit down and tell. I see all this stuff looking at the documents, but then actually get hear from someone who was there.
It's really fascinating, and again, I've got I think in the stack a letter that's very similar to the letter that Ray Trussell sent to the board when he stepped down, where he said, "I'm not going to join the board because it would be added pressure on Dr. Newman. I think he's terrific, but I don't want to add to the pressure." And I have a memo to somebody who asked me for some kind of assistance after I stepped down from Continuum, and I said, "Listen, I made it a principle never to interfere in anything, not even to give advice, and that's why I get along so well in my retirement with Beth Israel, with Continuum, and I ain't going to comment on it." So, I learned from him.
Yeah.
Anyway, listen, very, very nice to see you. And I can't tell you how pleased, grateful these colleagues of mine, about a dozen we get together every year or so.
Yeah.
And we're just so grateful that Sinai cares enough about Beth Israel to have an archivist who devotes himself to it.
Yeah, it's been great working with all of you.
Yeah. Chalmers died, I guess.
Yeah.
Do you want me to sign some?
Sign these, and also I'm afraid you took my pen.
Oh.
Yeah. So so we have
is it 2,000 years of my genetics. Sorry.
So sign and date here. This is just the permission form, and then so what we're doing with these oral histories is, if you want, we can put it online. We have but if not, if you'd rather just the transcript be in the archives, but it not be on on Google, that's totally you do that as well.
You can do anything you want with it. I just actually in the last 2 days visited the archival center at when possible.
Yep.
Anytime. I guess that means anytime, right?
Yeah. Yeah, we don't have all the technical end of putting them online up yet, but at some point in the next year or two, that's going to happen.
Yeah. Anyway, I visited the archival center, which is very impressive, at the American Jewish Historical Society down on 16th Street. And they have a copy of, we have an oral history of my mother, which we put into a wonderful book, and they have that, and they have it digitalized as well. And I imagine they might well be interested in what you might be willing to share with them in terms of Beth Israel Hospital. I mean, Christ, everything.
Yeah, actually, I know one of the archivists there.
Is that right?
Reached out to her. I know because they have all the Federation records.
That's right.
So they've got tons of stuff on the,
That's right.
And I've been meaning, I haven't been down there yet, but I want to do it at some point to see from the Federation side some of the controversies, like the Jewish Maternity Hospital.
That's right. That's right. Yeah. It'd be interesting, and of course the Federation, their hospitals had these annual, actually twice a year meetings, offshore meetings, insurance meetings, and so got to know a lot of the other members of the Federation family. Mount Sinai, Montefiore, Maimonides, the guy who developed not Splenda, but the sugar substitute. Yeah. Anyway, and he was the head of the board of Maimonides.
Yeah. Great. Hold on a second. Finish up here and stop the recording. But it's been great talking to you.
Thank you very, very much.
Feel free to get in touch.
And same here. If you have anything that with my lousy memory I might be able to share with you, I'd be happy to. And I will give you the name of the rabbi.
Yeah, great.